Before Jinja City works, the health centers are already full. Mothers arrive carrying more than children. They carry fear. Facilities built decades ago now serve a population they were never designed for. Beds are few, space is limited, and time is precious.
And we normally get like 200 patients per month. Because of the space we have, we could be wishing to admit more, but we don't have enough space in the patient.
Tetumala kubanga obona n'ebintu bwetu bipanga okulala kyetaga wabawo space omuntu wasobola okwekyukiza obulungi kuba butempeya nemba ne emergency muno muli kutomera bire muli kutomera bino kyetaga lebasuti yabakunga nene kusinga kukuwa.
In very small spaces where we are handling them from. Okay. So we do, if there is any chance, any opportunity to help us expand our maternity block, so that it is able to accommodate all these services, that will be the best.
In Busoga, malaria remains the leading illness, claiming the lives of children and weakening mothers.
We have malaria cases. This is the number one.
Malaria is too common here, and it is too much. This sub-county has a lot of malaria cases. Then seconded by the respiratory infections.
Men are rarely seen in this squeeze, arriving only when the situation has grown critical.
Okusinga abakyala n'abatera okuyida mu idwaliro ate era abakyala balala abo n'abaleeta abaana lwisi n'abaami balwala abakyala n'ababaleeta si abakyala n'abakasinze kuba bangi mu idwaliro.
Male have poor health-seeking behavior, so majority of them don't come to seek for health services early. By the time you see a male patient coming, most likely this is a very sick person.
Can we say they are doing self-medication, or they are just not, they don't feel that they have to come to seek health care when illness attacks?
It could be also cultural, that when a man feels slightly sick, should not cry. In our community, they even say, hey, you are crying like a woman. So these male patients actually do self-medicate a lot, and they rarely come.
Or still, not at all. This is not a distant crisis. It unfolds quietly every morning in the hearts of Jinja City. Busoga is a home to more than 4 million people. Jinja City, its only city, carries the weight of labor, trade, migration, and movement. More than 80% of residents cannot afford private health care. They depend on government and community health facilities, services meant to be free or subsidized. But these facilities were built in the 1990s, before the city expanded, before demand multiplied, and before modern pressure arrived. Today, healthcare here is not failing, it is stretched.
Obuzibu obusookera irala bwa infrastructure bw'olingirira ku wards daife dino likaali ntono okusinziira ku muwendo gw'abalwaire betufuna. Bw'oyidanga buti ku side eyo tuyida kugeta nti ya MCH tulina paati ya antinento. Bw'olingirira room ya antinento, room ntono tetumala. Tulina enaku abakyala de bayidanga bangi. Naddala olunaku olw'ebbalaza n'olunaku olwokuna. Abakyala bayidanga obonanga bangi, abasinga beemereire ku luya, beemereire mu corridors, n'ebyokutyama ku byene kati biri bamala, room yene ntono, obonanga kwegamba omukyala abatali kufuna mirembe, omukyala w'amabunda, kuba niiwe lwisi g'otali mabunda obonanga toli kubisibwa bulungi.
Across Uganda, malaria accounts for nearly 1/3 of outpatients' visits and 1/5 of hospital admissions. In Busoga, it's the leading cause of sickness and death, especially among children under 5. Mothers return again and again, pregnant, exhausted, and vulnerable. Children grow familiar with clinic corridors. Many of these deaths are preventable, but prevention requires space, supplies, and support.
When you look at our new structure, we are around 23% of the staff level. So 23%, and is serving, all those staff are serving all this population that you are seeing here. And it's not only population in the state, we are also near Jinja district. So we are getting patients all the way from Busoga sub-county, that's part of Jinja district, and they're also coming here. So we are serving an extra population that
of the district
that is coming here. Okay. When the government is counting our total population, it doesn't include them. But when it comes to getting services,
the reality speaks.
So the reality is really different, and our total numbers really sometimes surpass what we are expected to offer or to give.
In Bugembe, on the outskirts of Jinja city, stands Bugembe Health Center 4. Built in the early 1990s, it was once a small maternity ward for rural families. Today, it serves more than 300 patients every day.
Bugembe Center 4 olunaku bayinza okufuna abalwaire nga 3 olunaku olulala. Abalwaire nga 3 nga tugayisa okuva ku outpatient department paka wansi mu maternity abakyala gye bazaalira.
Under dry, dusty skies, long queues form outside antenatal units. Waiting areas built for 50 women now receive more than 100. This is a place meant to bring life, yet delays here can take it away. With expanded maternity wards, paved compounds, and proper waiting areas, care will no longer feel like survival.
Solution bwe babanga bateere nga batongeere ku shade kumpi n'abakyala baffe we batyama kiba kitukolera. Kubanga tulina ku shade edi tuli okumpi eyo ayi kabiri omukyala abatyaime wala omusawo bw'aba ajja kumweta ena batajawulira nti bali mweta, but at least twetaaga ku shade eri nearby room eno gye tukola ki gye tukoleramu. Aye nga wabaawo ni chance y'okuba nti bali gaziya kyona kiba kitukolera.
Closer to the city lies Walukuba Health Center 4. It serves fishing communities and dense informal settlements. Each month, more than 3,000 patients seek help here. Over 200 are admitted as inpatients, but care here is delivered without protection.
To manage at least an average of 2,500 patients per month.
500
per month.
per month.
Yes.
Without a perimeter fence, intruders enter freely. Medical equipment disappear, but also facilities, land is encroached upon. Healthcare workers operate under constant fear when security is missing and service suffers.
The major issue, in fact, could be the number one challenge. Walukuba Health Center 4, as you are seeing it, we need security to both our staff and patients. Security in terms of a perimeter wall. You see the facility is open since it is in an urban area with ghettos around. We need the place needs to be having a perimeter wall so that we don't lose our medicine and medical equipment we have.
At Mpumude Health Center 4, demand continues to rise. More than 100 patients arrive every day, but water bills are high.
We would need a water harvesting system for the facility so that we never run out of water, or in case we can also, so that we don't run out of water, we can control our water bills.
We have revised a method, and it is easy to control the water bills if we can supplement the national water with rain harvest. And what we did recently, we bought 2 big 10,000 liters of water tanks, but they are not enough. If we are eyeing like we need more 5 water tanks of 10,000 liters so that we reduce on that bill, a huge bill of water bills.
Electricity costs strain limited budgets. Staff live far from the facility, delaying response and care. Improved staff welfare housing, and reliable utilities will transform service delivery, turning exhaustion into efficiency.
Implementing partners or donors to support us with staff quotas, because more than 90% of our staffs do not have accommodation at the facility, and yet they have to come and deliver very urgently needed services at the facility.
Farther from the city center lies Budondo Health Center 4.
I'm Samuel Mwesgo, and today we are at Budondo Health Center 4
that serves surrounding rural communities. Here, distance remains a barrier, utility costs are overwhelming.
It is hard for us to have a 24-hour day electricity available. So it is on today, tomorrow it is off, on, and like that. Almost every day we have to use a generator to help us.
So you have a generator?
Serve. Yes. We have a generator, and we have some implementing partners together with the PHC money that we use to fuel that generator. And some departments also have some solar lighting systems to help us light in the night.
Okay.
Yes.
Many mothers still turn to traditional birth attendants, not by choice, but by circumstances.
It is one of the biggest challenges that Budondo Health Center Fund, the Budondo community has. Our Budondo community has a number of traditional birth attendants, and the majority of our mothers, unfortunately, still believe in giving birth from traditional birth attendants. However, we are trying to reaching out to these communities to do sensitization. We have tried to reach out to the people who are practicing this, the traditional birth attendants themselves.
Doctor, on the same note, have you gotten some cases of mothers who went there for delivery and there is a failure and then they are referred here?
Very many mothers that we have been getting almost on a daily basis. Those who come in a very bad condition. Actually, most of the maternal death, most of them that have happened to our facilities, not only in the Budondo, even in Jinja hospital, most of them are coming from these traditional birth attendants. They come in by the time they realize to refer these mothers, it is late. Okay. Either they have lost the baby or the mothers are at the brink of death. That's when we receive them. So we receive very bad cases from the people. One, this traditional birth attendant who is attending to these people may not actually identify any danger sign, any complication that this mother is having. It also just gets her or him unaware, and that's when he will say, you rush to Budondo Health Center 4.
With solar power, rainwater harvesting, and community education, safe deliveries could become norm and not exception.
We have also engaged with the different stakeholders, the resident state commissioner, the political leaders to help us talk to these people, but I think we need more engagement with the people who are practicing this and the community themselves, because it seems the community also have more faith
in
them maybe than us.
For years, these challenges waited for solutions, waiting for budgets, waiting for systems, waiting for help. But in Jinja City, waiting was no longer an option. The community chose a different answer. Before traffic fills the streets, people gather dam waters, the heart of Jinja City. Women, men, children, persons with disabilities. Runners from across Busoga and beyond Uganda. Not to compete, not for medals, but to run for life. Led by Fist Uganda, the Jinja City Marathon was born from one urgent belief: when healthcare is fragile, the community must rise.
Okukola Jinja City Marathon which is going to last forever. It's not only us who are going to run it, but even our great-grandchildren, with your blessings.
The runners move through the city and its outskirts. 21 kilometers, 10 kilometers, 7 kilometers, and 5 kilometers. Every stride carries a message. Every breath speaks for a patient waiting in line. This is a race with a purpose, a campaign to mobilize resources, to draw attention, to protect the health centers that serve the most vulnerable.
Our major cause and our theme for this year, Jinja City Marathon, Adaire, Run the Nile, Explore Jinja, and Save a Life. We are running the Nile because we are appreciating the beauty. We are exploring Jinja because we want to promote tourism in Jinja and Busoga in general. And we are saving a life because we've realized that our mothers have a few things that are lacking but are so pertinent. And this time round, we were looking at the mama kits and possibly some incubators.
Leadership joins the movement. The Deputy Prime Minister of Busoga Kingdom runs as the chief runner.
Jinja Marathon, I am honestly impressed. This is a very good start. Era naenda okusima abategesi abategeike Jinja City Marathon. I have been associated with so many marathons in Jinja here, but I'm honestly very, very impressed with this start. I am sure next year will be better than this.
Calling on the Busoga people to embrace community-led solutions.
Supporting health initiatives, raising awareness, and investing in the well-being of vulnerable communities through Feast Uganda and our partners. As we run along the banks of the majestic Nile, we are reminded of the beauty of our homeland and the power we each hold to make a difference. From seasoned athletes to first-time runners, you are all heroes of today's story. To our participants, thank you for bringing your energy, your passion, and your belief in this cause.
Partners, sponsors, and institutions stand together, proving that healthcare is not only a government responsibility, but a shared one.
Tulina okuba nti ife aba Kampala Capital Authority twabaire nga tusobola kusigalayo olwakubanga okulumuka kuno kubaire kugema ku byabulamu, kubaire kugema ku bamaama, kubaire kugema ku baana baife. Olw'obulamu obulungi twena twidye era tukubasaba nti mwena mutweyimbanga ku olundi.
Ayiye buli ali wano nenda okubakubiriza nti omwaka ogwiraku omukyala abaana ne baneiba bono bazuukuse baide tube mu kintu kino.
Alikwambaza namba ndala on that category. Tubeyanziza. I will thank the organizers for bringing us an inclusive event.
As runners cross the finish line, awards are given, but the true story lies elsewhere.
The third winner in the 21-kilometer category, Ochen Charles. Yay, Bani Mohammed. And the second winner, Oyo Iguru Abdallah. Moise Iguru, yes. Oyo Moise Iguru. Then tuina Omusugu Nathan. Omusugu Nathan. Overall winner from the 21 kilometers. That is Omusugu Nathan. Bana Obugaro. Kampala Capital City Authority.
The Executive Director.
In stronger health centers, in safer deliveries, in children who return home.
Ensaba ejjem Busoga Kingdom okusiima emirimu emirungi Busoga Kingdom gyetukoleire nga ife abantu n'obusoga bwona babajiikirize mu kitiibwa.
For every mother who waits in line, for every child fighting malaria, this race is not about speed, it is about life. Busoga's healthcare system stands at a turning point, and when systems strain, communities can still move them forward. This is what it looks like when people do not wait to be saved. They run.
With deepest gratitude and royal salutation to His Royal Highness, Isebantu Kyabazinga of Busoga Kingdom, in honor of your steadfast support and noble commitment to improving the health and well-being of the people of Busoga. Your wish and compassion leadership remains a beacon of hope and transformation across the kingdom, presented with utmost respect during the Jinja City Marathon. Run the Nile, explore Jinja, and save a life. On the 24th of May, 2025, signed by Barry Jusa Nelson, CEO, Fist Uganda. Thank you so much.